Hello, this is Dr. Kruger here from our Atlas Health Medical Group's Gilbert, Arizona clinic. I just wanted to give a quick overview of what a platelet-rich plasma procedure will look like for a knee pain treatment. Now, this is very, very common. Many folks end up having knee pain, especially middle-aged to older. It's generally considered as a wear and tear, even though that might not be the most accurate description nowadays, as there's other components to it, such as blood flow, hydration, nerve involvement, nutritional status. So there's various components to look at there. But with the knee pain, what we want to do is treat the entire joint with PRP. So PRP is platelet-rich plasma. We take it out of the blood. So we're going to take about 60 to 120 milliliters of blood, and then we're going to spin that down in the centrifuge, separate it out into red blood cells, white blood cells, and plasma. So 3 layers after the first spin. Then that plasma with some of the white blood cells is extracted out, and we get rid of the red blood cells, which are inflammatory when you inject them. So you don't want to be injecting red blood cells into the joint. You take the plasma and some of the white blood cells, you spin it again the second time for a longer duration and a higher speed, and that concentrates the platelets down into the bottom of the plasma, and that's how you get the term platelet-rich plasma. So it's basically just the bottom layer of the concentrated plasma. You can get rid of the platelet-poor plasma and then just use the platelet-rich plasma, and that will be anywhere from 4 to 5 times stronger than your circulating platelet levels in your blood. And you can even go stronger than that. You can go, up to 10x if you want for certain conditions, and that might be beneficial for you. With that, though, you might have to take more blood. So it's pretty standard 60 blood draw. At our clinic, we usually go 60 to 120 when we treat a joint, just so we get a lot of plasma, and we can really play around with the dosages, individualize it for each patient. Sometimes in our older folks with the really chronic degenerative joint, we might want to do a stronger therapy for them. Where the younger athletes, the younger healthy people, they're going to respond quicker, and they might not necessarily need such a high dose treatment of the PRP. So we take the blood, we spin it, concentrate it down, and now we have PRP, which is basically a strong growth factor solution. So in your platelet cells, they're chock full of growth factors, many different growth factors that do different things. So the easiest way to think of PRP is a high dose growth factor injection. So we take it out of the blood, spin it, process it, get it ready. And then what we're going to do is take those growth factors and we're going to treat the entire joint. So when we treat a knee joint, we're not only going to put some fluid into the knee joint capsule, which is going to help with that cushioning and also help with the cartilage, and it'll change the local environment. It usually takes that inflammation away over time and creates more of an anti-inflammatory joint. So we'll put the majority inside the joint, but we also do a comprehensive approach, and I think this is why we get such good results, is we're also going to treat the entire joint here. So we'll go ahead and treat the LCL, which is on a lateral collateral ligament, and we'll strengthen that up. So we'll treat that. And then on the anterior side of the joint, we're also going to treat the quad tendon, which comes onto the kneecap, the patella here. And then we also treat the patellar tendon, which is on the kneecap, and it goes to your lower leg. So we treat that. Often with runners, they're going to have some more of this type of pain. And then the big thing is we also treat this MCL, and you can see how big the MCL is compared to the LCL. So the MCL is very big and strong, and often in degenerative arthritis, you'll also have some ligament laxity and damage of the MCL, which kind of creates a loose hypermobile joint that has more kind of articular interaction, grinding down the cartilage, putting more stress on these ligaments and more stress on the meniscus. So we're going to go ahead and treat the MCL, and sometimes if there are meniscal issues, we'll go ahead and treat those as well. So it's not just a one-time shot into the joint. I mean, we're going to treat the joint very thoroughly. We're going to treat all the structures of the joint, all the tendons, all the ligaments, as well as in the joint for the cartilage. And this comprehensive approach is tolerated very well from patients. We use local anesthetic as well as topical anesthetic if needed. Sometimes we'll go ahead and use pain medications as well, depending on the patient's pain threshold and how they tolerate procedures. This whole process can be completed in about 2 hours, and that includes orthopedic examinations, ultrasound examinations, deep and soft tissue palpations, the whole clinical intake, the blood processing, and then the ultrasounded guided injections, which we use for accuracy in the knee joint. Now, depending on where the patient is in their knee pain and arthritis, we might have to repeat the procedure. So some of our older folks where the knee pain is quite severe, moderate to severe arthritis, one treatment is probably not going to be sufficient to get the pain down all the way. When you're younger and healthier, you respond and heal up quicker. You have a higher concentration of stem cells in your body. So those folks might only need 1 or 2 PRP treatments. And our older folks that have knee pain, chronic knee arthritis, sometimes they need 3 or 4 depending on the situation. And also we're going to have to address, the lifestyle factors as well to get better outcomes with the PRP. So that's very important. Changing the nutritional situation, rehabbing, getting the muscles engaged again. Proper hydration, very important for the cartilage, which is mainly made up of water. And then getting some of that sugar out of the diet, which is chronically inflaming the joint and contributing to that arthritic pain. So this is a very comprehensive approach. We're looking at all angles of pain and arthritis, and we will address the lifestyle factors that definitely contribute to the pain to get better results. But the PRP treatment alone is very, very strong and effective. It's more effective than corticosteroid injections such as cortisone, and it's actually more effective than hyaluronic acid injections such as Synvisc or Orthovisc. So PRP is one of the best non-surgical options you can use for knee pain. And we've helped a lot of patients prolong knee replacement surgery or entirely avoid knee replacement surgery with this treatment approach.